Hi, I'm Dr. Melissa Ertl, a T32 postdoctoral fellow with the HIV Center for Clinical and Behavioral Studies at Columbia University and New York State Psychiatric Institute. I'm delighted to share with you today a research poster from my doctoral dissertation, which I worked on in collaboration with one of my mentors and colleagues, Dr. Frank Dillon. The topic of the poster is experiences of sexist discrimination as a potential explanatory factor for alcohol and drug misuse among Latina young adult women. Marianismo beliefs are traditional Latina gender role beliefs that encourage Latina women to be nurturing, self-sacrificing, virtuous, and spiritually strong. And past research has found that Marianismo beliefs is a multidimensional construct that's actually comprised of 5 belief pillars, which have been found to be differentially associated with health-related factors. So the 5 belief pillars include family pillar, virtuous and chaste, silencing self to maintain harmony, subordinate to others, and spiritual pillar. Some of these beliefs have been identified as potentially protective against substance use, while others are linked with increased use. However, few studies have examined possible explanatory factors underlying the link between Marianismo beliefs and substance misuse. According to the theory of gender and power, sexism or sexist discrimination in the form of gender-specific negative life events or stressors that women experience can actually be a social force that produces gender inequities. Consistent with this notion, sexism may be one factor that links Marianismo and substance misuse among women, as the gender-based beliefs and expectations that Latina women hold may be reinforced through sexist experiences that in turn impact their substance use and their overall health. So building on this developing literature, the present study examined Marianismo beliefs in relation to sexism and substance misuse among a large national sample of Latina young adult undergraduate students. The objectives of the study were to test sexism as a potential explanatory factor for substance misuse, and we hypothesized that sexism would mediate associations between Marianismo beliefs and both alcohol and drug use. Participants were 602 Latina undergraduates ages 18 to 26. We assessed measures of Marianismo beliefs, experiences of sexism, alcohol misuse, and drug misuse. We also assessed demographic variables that served as covariates in the model. The model included each of the 5 Marianismo beliefs as independent variables, sexism as a mediator, and alcohol and drug use as dependent variables, with each of the demographic covariates also included. In terms of direct effects, only the virtuous and chaste belief was negatively associated with sexism. Regarding alcohol misuse, both the family pillar belief and the virtuous and chaste belief were negatively associated with alcohol misuse. Conversely, the spiritual pillar belief was positively associated with alcohol use. And for drug misuse, only the virtuous and chaste belief was negatively associated. To test for mediation, we used bootstrap procedure with 1,000 bootstrap samples to estimate the standardized total indirect effect of sexism on the significant associations between Marianismo beliefs and both alcohol and drug misuse. And results revealed that associations between the virtuous and chaste belief and alcohol misuse and drug misuse were mediated by sexism. In terms of conclusions of this research, our results indicated that certain Marianismo beliefs were potential protective factors against substance misuse, specifically endorsement of the family pillar belief and virtuous and chaste belief, and that sexism mediated associations between the virtuous and chaste belief and alcohol and drug misuse. Latina women who endorse relatively more of the virtuous and chaste belief, or the notion that Latina women should be pure and chaste, may be protected against alcohol and drug misuse because they tend to report experiencing less sexism than their peers who report less endorsement of the virtuous and chaste belief. Findings emphasize the need for health professionals to address the impact of sexism on health among Latina young adult women and may inform screening and health interventions that address substance use to improve health outcomes. For example, substance use prevention efforts with Latina young adult women should attend to Marianismo beliefs that may be protective, such as the idea of staying healthy for one's family, and should consider how sexist experiences may exacerbate substance use. Interventions to alleviate the burden of sexism are needed, particularly intersectional frameworks that attend to multiple forms of oppression that may impact Latina young adult women. Thank you very much.